Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Skin changes in elderly. There will be reduction in skin thickness. In epidermis, there will be reduction in overall cell count and cell turnover. Cellular turnover means stratum basal cells differentiating into spinous layer cells, then to granular layer cells, then to corneocytes, and ultimately shedding off. This turnover will be reduced, which leads to big corneocytes, short and fat keratinocytes. In dermis, there will be reduction in both elastin and collagen. Mainly elastin will undergo calcification and collagen bundles will become disorganized. Overall, in old age, there will be reduction in skin thickness. Elevation in skin surface pH, which is due to overexpression of epidermal sodium hydrogen exchange 1. If skin pH is increased, which leads to stimulation of pH sensitive serine proteases, which leads to destruction of corneodesmosomes, ultimately leading to stratum corneum integrity loss. This concept of serine proteases and its inhibitor, serine protease inhibitor Cajal type 5, SPINK5, which is mutated in Netherton syndromes, where there will be more and more destruction of corneodesmosomes. All these concepts I have explained in my previous video on desmosomes and acantholysis. If skin pH is increased, there will be stimulation of serine proteases, and also there will be disruption in lipid processing and lipid formation, which leads to disruption in barrier functioning of skin. In old age, there will be reduction in ceramides and hydration also. These ceramides, if they are reduced, which will lead to again barrier function disruption. If corneodesmosomes are destroyed, if lipid processing is not good and ceramides are reduced, all these will lead ultimately to barrier function disruption, which leads to dry skin, a condition called steatotic eczema. Hydration, how it is going to reduce in old age? Because of reduction in expression of aquaporins and natural moisturizers. Aquaporins are nothing but pores, that are channels which allow the movement of water and glycerol, ultimately leading to reduction in hydration. Hydration plays an important role in cell differentiation, proliferation, and regulating inflammation. Hence, in old age, we have to give supplementation of moisturizers for skin. There will be reduction in sebum production, but sebaceous glands will be enlarged due to reduction in cell turnover. There will be reduction in sweat production and also reduction in number of sweat glands, both eccrine sweat glands and apocrine sweat glands. If there is reduction in sweat production in response to heat, which may lead to heat intolerance, heat stress, and ultimately heat stroke. All these are more prone in old age. Why? There will be reduction in thermosensory function, because there may be age-related sensory neuropathies and reduction in number of thermosensory receptors and reduction in nerve conduction velocity also, which leads to decrease in response to heat and response to cold. In response to cold, a normal individual has to shiver and he has to get vasoconstriction to withhold the heat within the body. But in old age, there will be reduction in cold response and there will be impairment in vasoconstriction and shivering also. All this will lead to thermosensory function impairment. There will be reduction in cutaneous blood flow. And cutaneous vasculature, there will be reduction in angiogenesis and impairment in vasodilation, ultimately leading to reduced blood flow to skin. Coming to skin microbiota, streptococci are more prominent. Enteric organisms also colonize especially in moist areas. Hair follicles reduce in size, hair shaft diameter also reduces, which ultimately leads to conversion of the terminal hair to vellus hair before disappearing permanently. Hair will become gray because of reduction in the number of melanocytes, and melanocytes will become inactive, which leads to reduction in the pigment melanin in hair, leading to the appearance of gray hair in old age. Coming to nail changes, the normal growth rate of nail will be reduced. What is the normal growth of nails for fingernails? It is 3.5 mm per month. That means every 10 days it will grow 1 mm. Toenails will grow exactly half to that of fingernails, 1.6 mm per month. Because of this reduction in nail growth, there will be large corneocytes and increased number of Pertinax bodies. What are these Pertinax bodies? These are structural residues of nucleus. Nails in old age will be low in lipid, water, calcium and iron, but high in magnesium. All these nail changes will lead to easy damage and splitting of nails. There will be absent lunula and accentuation of longitudinal ridges, loss of double curvature, both longitudinal curvature and transverse curvature, which may lead to flat nail called platonychia, spoon-shaped nail called koilonychia, which is also seen in condition of chronic anemia. Coming to fingernails, they will become soft, friable with longitudinal fissuring and onychoschigia, which means splitting of nail at the free edges. Toenails show onychosis, that is thickening of nails, and onychogryphosis, which is nothing but hypertrophied, disorganized toenail, which will look like ram's horn. Next, coming to physiological skin changes in old age. Number 1, idiopathic guttate hypomelanosis. In the name itself, we can see hypo, to depigmented macules with fine scalloped borders, mainly over extensors of upper limb and lower limb. What is meant by this scalloped borders? Here you can see what is a scalloped margin. A scallop means a shellfish, which margins are named after this. You can clearly appreciate the free edges of a scallop, which is named scalloped margins. Next, senile purpura. Seen exclusively on photo-exposed areas, may appear following trauma, which resolves extremely slow. Senile freckles, also known as solar lentigo, old age spots, which are brown macules with irregular edges over face and dorsum of hands, nothing but over photo-exposed areas. Sebaceous hyperplasia, I already told you there will be reduction in sebum, but sebaceous glands will enlarge. They are benign, yellowish papules on forehead, cheek, occasionally on chest and upper back. Seborrheic keratosis, RRHE, seborrheic keratosis, benign tumor of keratinocytes, which looks like pigmented, hyperpigmented papules, plaques with acanthosis with follicular keratotic plugging. This acanthosis and follicular keratotic pluggings we can appreciate in histopathology. Sometimes the lesion will be with cerebriform surface, which we can see gyri and sulci like on dermoscopy. One classic feature on dermoscopy is comedo-like opening, which corresponds to this follicular keratotic plugging. For every lesion, we have to correlate between clinical appearance, histopathology and dermoscopic features. Coming to last, dermatoporosis. In this condition, skin will become very fragile because of chronic damage to skin integrity due to aging and chronic exposure to UV radiation. It has 4 stages. Number 1, senile purpura, stellate shaped pseudo scars. Stellate means star shaped atrophy. Stage 2, erosions. Stage 3, extensive erosions. Stage 4, final stage, severe skin damage with dissecting hematomas. Coming to immunity of skin in elderly, there will be gradual deterioration of immunity with aging, that is called immunosenescence. Old age is marked by increased susceptibility to cutaneous infections and malignancies. There will be reduction in plasmacytoid dendritic cells, which are important for protection against viruses, which explains the reactivation of herpes zoster in old age. Reduction in Langerhans cells will make the old more prone to infections and malignancies. There will be impairment in toll-like receptor signaling macrophage, phagocytosis. After menopause, there will be significant reduction in estrogen, which leads to dry skin, and reduction in axillary hair, pubic hair, and scalp hair called senile alopecia. There will be reduction in dermal thickness and skin elasticity also. Elasticity means if we pull the skin and leave, it has to go to its original place because of elasticity. If it is lost, if we pull and leave the skin, it will stay there only. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Das vidaniya.